of a half a face. Okay? And when we look at that picture of a half a face, it shows the nasal passage. I didn't have a model for that, did I? No. So this hole right here is the external nares. There's a little pocket right there, that's the nasal vestibule. And from here to a little ridge in the back is the nasal cavity. Remember, in the nasal cavity we had the superior, middle, and inferior concha. Superior and middle are part of the ethmoid bone. The inferior is a bone all by itself. It's covered with mucus. Covered with mucous membrane. It's got a lot of blood vessels. The function of the respiratory tract from the nose all the way down to the terminal bronchiole is to warm, cleanse, and humidify the incoming air. We're supposed to breathe through our nose. When I go back, there's a little ridge called the internal internal nares.
Okay.
I got to go past the internal nares, and now I'm in the nasopharynx. I'll show you a slide in a little bit. Then I'm in the nasopharynx. In the nasopharynx, there's a little opening that goes to the middle ears. It's called the opening to the auditory tube. I've got a frontal sinus here, and when I go back into the nasopharynx, I have the sphenoid sinus. I have a tonsil in the nasopharynx called the pharyngeal tonsil or the adenoid. So here, come here. There's the external nares, there's the nasal vestibule. This is all the nasal cavity. Here's your superior, middle, and inferior concha. There's your frontal sinus, there's your sphenoid sinus. Right there is your pharyngeal tonsil, see it? That ridge is the internal nares, and right there is the opening to the auditory tube. From there to there, that's the nasopharynx. Okay? This is the oropharynx, and this is the laryngopharynx. But remember, the nasopharynx is only involved in respiration. The nasal, only in respiration. The oral and the laryngo are involved in respiration and digestion. All right, so that takes care of this. Now, this is the larynx, and so this is the epiglottis.
What's the glottis?
This is the epiglottis right here. It covers the glottis, and the glottis is that hole. We define it as the hole between the vocal cords, right there. Okay? So we look, and this is the larynx. It's made up of 9 cartilages, 3 unpaired. The 3 unpaired are the thyroid cartilage, the cricoid cartilage, and the epiglottis. All right, then we have 3 paired. Can you see the witch's boot right here?
Yes, sir.
That's the arytenoid cartilage. And that toe is the corniculate cartilage. And this is the cuneiform cartilage. So I've got, see the witch's boot? That's the arytenoid cartilage. And this toe is the corniculate cartilage. And this is the cuneiform. So I've got 6. 6 and 3 is 9, 9 cartilages. So I come back to the thyroid cartilage. This, feel that V right there, midline. Feel it? That's this. This is the laryngeal prominence. This is the Adam's apple. Because this is the thyroid cartilage and this is the hyoid bone. This is the thyrohyoid membrane. This is the thyrohyoid ligament right there. Now the only cartilage in the bronchial tree that's a complete ring is the cricoid cartilage. See how little it is here? Look at how big it is in the back, but it goes all the way around. All the other ones are C-shaped. So this is the cricoid cartilage. This is cricoid, this is thyroid. See that little ligament right there? This is the cricothyroid ligament. All right? And so we've done these. I've got 2 different types of vocal cords. This is the false vocal cords, and these are the true vocal cords. False vocal cords are meant to catch things before they get stuck and damage the vocal cords. And then this is my trachea. Now, the cricoid cartilage actually attaches the larynx to the trachea. Give me the trachea. So here, this is the trachea. 16 to 20 cartilaginous rings that are C-shaped because it's open in the back so we can swallow big things. So I come down the trachea, and inside there's a little ridge called the carina, and it splits the trachea into the right and left primary bronchus that are in the mediastinum. And then it splits again. On the right, I have 3 lobes. On the left, I have 2. Okay, because the heart's here in the way. So when I come over here, I've got 1, 2, 3 secondary bronchi, and here I've got 1, 2 secondary bronchi. That is in the lobes of the lung. And then I have the tertiary bronchi that are in the bronchopulmonary segments, and I've got 18, 10 on the right, 8 on the left. And then they get smaller and smaller. Hand me that one.
Where's the dead space? Where would the dead space?
The dead space is actually in here,
Inside.
all in this bronchial tree.
Okay.
When we look here, they're getting smaller and smaller and smaller. So this is a small bronchiole. It would be way down here. So here's the small bronchiole. These are terminal bronchioles. Terminal bronchioles tells you that my cartilaginous rings terminate there. They stop there. Once I go below the terminal bronchiole, I don't have the cartilaginous ring anymore. And then it makes these little ones, and these are respiratory bronchioles. They don't have the cartilaginous ring. And they empty into the alveolar duct, and the alveolar duct empties into the alveoli, all these little marshmallows. Okay? And it's in the alveoli that we have the actual exchange of the gases. When I look, this is the apex of the lung, way up here above the clavicle. And this is the base, it's right on the diaphragm. When I look, the left lung is a little bit longer than the right lung because the liver sits right here pushing up on it. Okay? When I look at the trachea and it comes down and splits, feel the jugular notch right there, and come down and you feel a little ridge right there.
Feel your t-shirt. Or something. Gotcha. Yes.
All right? That is the sternal angle. And the trachea actually splits right there. People think it splits way down here, it splits up here. Okay? So that's where we have the right and left primary bronchi. When I look at this is the right lung, this is the left lung. Here I have the superior lobe of the right lung, the middle lobe and the inferior lobe. Here I only have the superior and the inferior lobe. I don't have a middle lobe because the heart's in the way. Where you see the blood vessels going in and out of the lung, that's the hilum. See the blood vessel and the bronchial tree going in and out of the lung here?
Where's the hilum at?
The hilum is that area right there where they're going in and out. When we look at this, one of the things I failed to mention to you is this is the pulmonary artery, deoxygenated blood. And this is the pulmonary vein, oxygenated blood going back to the heart.
Gotcha.
Okay, yeah. Okay. Now we got to remember, this blood that came over here to pick up oxygen and get rid of CO2, the lung doesn't get to use any of that. It actually gets its blood for the tissue of the lung from the carotid and from the thyrocervical trunk and from some of the bronchioles. It takes it down there. Okay? But as far as models, that's it.